Welcome to Life by Design for Chiropractors, episode 100.
Welcome to Life by Design, the podcast for chiropractors. Here's your host, Dr. Jamie Richards.
Welcome to Life by Design. I'm your host, Dr. Jamie Richards, and on today's episode, episode 100, we tackle the second buying decision. And I felt like one of the best ways we could handle this was to give you live commentary and an insider's look at the Life by Design training camp. So we pulled some of the content from the recent sold out Life by Design training camp where we were talking about the second buying decision, what we call the RCC. And we went through some really important components, all of the objections. I talked about the reverse authority play, which is really one of my favorite plays in making agreements with people, especially at this point in the second buying decision. So I know you're going to get a ton out of today's episode. And if you want to be at the next camp, it's just about to drop. We'll open up 15 more spots, and we'll fill those up. It'll be coming up in February, so I'll put a link here somewhere in the show notes, and you can grab a look at that. And if it's something that resonates and you want to be here and train with us, grab lunch with us, have dinner with us, physically train with us, and really immerse yourself into the Life by Design for chiropractors training systems, A to Z, really taking people from the first point of contact all the way through creating a lifetime patient at an extremely high rate, extremely high retention rates, extremely high acceptance rates in a way that's authentic and fun and enjoyable and probably most importantly, extremely profitable. So if you want to do that, check out the link. Otherwise, enjoy today's episode of Life by Design for chiropractors. Okay, so before the break, we talked about the RCC. So we considered that the most important visit in the practice and call that our second buying decision. So the time when people purchase from you the second time, okay? And so, that first day two, like I said, I want you to get really great at it. We want to come up with a framework of communication that creates really strong agreements and gets a really engaged person buying in who's going to start and complete your corrective care over 80% of the time. So that's the reason why we still focus on that. But what happens at the end of corrective care? One, let's assume they made it through. So that's not a guarantee. That's part of your delivering great customer experience. The wow factor, potentially some talk triggers in there, great table talk, great communication. Having a very clear idea of where you're taking people from point A to point B. Then we're going to go through the full comprehensive re-examination, and then we're going to sit down and have that second buying decision. So we went through the basic template, which was connect, let them know what we're up to and what we're going to do that day, recap their case, celebrate their case, anchor to subluxation, go through the process again, get them to self-grade, and then go ahead and show them test results, go over, if you are doing scoring, go over their biostructural or neurostructural scoring, and then let them know what the next phase of care looks like. So explain, give them context as to why you make the decisions you make. And that goes back to talking about, the importance of transparency. If you're not communicating to people about why you're doing what you're doing, why you're recommending or requiring something, then it becomes difficult for them to really understand fully. And then it's just, we need to see you every week. Man, it seems like this guy wants to see me every week for the rest of my life. Versus explaining the rebuilding phase. Another way that we could explain it, oftentimes I'll use, I don't like the braces analogy and retainer because I find braces and retainer kind of elicit this idea of corrective, and now you're in wellness or optimization in terms of a retainer. So with the rebuilding, I'll just use kind of the second half of having braces. So say, your corrective care is like when you first get braces and you've got to go and they're working on them regularly and tightening them and checking them, and then that progressively becomes less and less and less to the point where you're still checking in, but not ultra frequently. That's the rebuilding phase. They're checking in just enough that we're not going to see any backward trends, and the structural change in your teeth can continue to move forward. And that way, that analogy allows me to use the retainer as the analogy in the optimization phase, because that becomes a lifetime, annual repetitive cycle. And for most people, the retainer just becomes a lifetime thing that they have there to protect the changes that they made. Another good one for people, at least around here, is a golf analogy or any other skill. So we could say, have you ever taken up golf and you weren't very good? Oh yeah, and did you get lessons? Well, I didn't, but my sister did or somebody did. So you go to your golf coach and you got a lesson, 2-3 times a week. And you might do that for 2 or 3 or 4 months. And at the end of that, if you were to stop getting lessons, what do you think happens to your golf swing? What do you think they say?
It gets worse.
Yeah, it gets worse, it goes back. Right. Here's why. Because you don't own that swing yet. It's not yours. And the same is true for the changes in your spine and nervous system. So you've gone through corrective care, we've made these amazing changes, you're having these amazing results in terms of the subjective experience for you, but these changes aren't yours yet. You don't own them. So what we need to do in this rebuilding phase is we need to see you just enough to continue to anchor these changes in and make them the new normal. So that's, one of my trademark phrases in rebuilding is we need to turn this change into the new normal. Right? So when we prep them and get them into, say, an optimization, or even if they choose a more maintenance type schedule going forward beyond, we're communicating that a lot of the big changes have been made in their body, in their spine and nervous system, and that going forward in optimization, what we're generally doing is we're checking and correcting subluxations, blockages, stress that they create between checkups. Right? And we've seen this with kids earlier, where you might go through a corrective care phase, and then, you're doing the checkups, corrections, and we don't really need a rebuilding phase. It's almost like 16 weeks of care for a child. They're pretty much through correct and rebuild. And basically, when I check this infant, I'm only correcting stressors that were accumulated in the time between the last checkup, right? For most cases, there's probably some more severe cases where the patterns are deeper and more underlying, but for the most part, we're just clearing out patterns that they're creating as they go. And so that's how we're going to frame it with adults in the optimization phase, right? It's, we've cleared out a lot of the old patterns, years and years and years of structural stress and neurological stress, and now we're dealing with what you're creating in between checkups. Now you're going to get some older cases and people who are just really structurally distorted and neurologically compromised. You're probably going to be working towards and peeling layers of the onion off for decades. Okay? So I like the rebuilding conversation to be built around trying to create the new normal, and then that sets you up for the optimization. So again, if you go back to the day one of camp, we were talking about how each step builds on the next, and then it's important to focus in on the goal within that step and not get ahead of ourselves. So it's not day one case review, lifetime care, innate intelligence, don't take drugs, medicine's terrible. That's not a day one conversation. Most of that's not even a day 5,000 conversation, right? You got to look at what's going to qualify people and what's going to disqualify people as we move through these stages. So we've set them up, we've gone through correct, we're into rebuild. We're going through that anchoring now, so we've showed them their test results, and now we're going to go through that reverse authority play, just like we talked about. So the key question here is getting them in their mind to understand what rebuilding looks like, what the goal is, and then just asking them, great, Chantel, how many times have I been checking you each week at this point?
Twice.
And how many times have I never made a correction?
Never.
Right, so what does that tell you about how clear your nervous system is staying or how long you're holding the correction?
Just a few days.
Yeah, probably not more than a few days. But I don't want you to think of it as, you get checked, corrected, and then within 2 days you lose everything. It's more like a dimmer switch. And so think of it more like a gradient. We check you, correct you, the dimmers go up, and then there's a slow, subtle decline, 90%, 80%, 70%. And there's day two, we check you, you are subluxated, we correct you, dimmers go up, and then you complete and repeat that process. So in the rebuilding stage, we want to set your frequency where the dimmers are going to go down, but they don't go down so far that you start losing results. So what do you think? In fact, if you were the doctor, what would you do? What do you think would make sense as a frequency in your rebuilding phase?
Twice a week.
Yeah, twice a week based on what you're telling me. I'd like to push the envelope a little bit. I think you can sneak out to every 5 to 7 days and let's see what happens. Now, what I will say is what you do between checkups now becomes extremely important, right? Because I'm not there to check in and make corrections. So, we're in a sense the cleanup crew. Subluxations are there, we check them, we correct them. With more time in between, doing your spinal hygiene exercises, dealing with nutrition and stress, those are going to be really important components, okay? Mm-hmm. So I know we talked about Eat by Design, you created yourself as a C. Mm-hmm. So let's try and add protein with every meal now, since you've been eating more real food. In terms of the corrective exercises, do you think you could you've been to Eat by Design?
Yeah.
Do you think you could follow the routine 3 times a week?
Yeah.
Okay, so I'm going to add that to your notes. So that's your 2 goals is protein with every meal, and we're going to do corrective exercises 3 times a week. Okay? So then let's do that. Let's check every 5 to 7 days, And given that your score is 52, we're going to do that for 21 weeks, okay?
Yep.
And at the end of that, we'll go ahead, we'll do new tests, and we'll make some new decisions that are based on the test results and based on your goals.
Okay.
Great. So again, that's essentially how it's going to flow. The key is, even if you get lost in that process, find your way back to, here's what rebuilding is, explain what you're looking for, explain your criteria for why you're setting a frequency the way you're going to set a frequency, and then let them be the doctor. So how many times have I been checking you? 2. Most important question, right? How many times have I never had to make a correction? That's the question. That's the key turning point for them in their mind to say, yeah, probably should be here at least every week, if not more in most cases. Okay, and so now they're able to move forward in rebuilding, and it's their decision. Okay, and then we go over whatever the other ancillary things are. So we cover if there's a VIP program, we cover finances and fees, and then in our case, the family pass. So let's talk about some different objections then that would come up here. Right? I'll do the obvious ones, and then if there's any that I'm missing, this is a great time to do it. So let's say I go through with Chantel, and exactly the same. Let's assume she gets the question right, and she says, well, I probably should be here about every week, I guess. Great, let's do that. Let's see every 5 to 7 days, and given that your score is at 52, we're going to do that for 21 weeks. At the end, we'll go through the whole thing, and then she's going to say something like, well, I was kind of hoping, that I come every 10 to 14 days. Well, they wouldn't say that. They're going to say, I'm kind of hoping that I come every couple weeks. Okay, so what makes you want to come every 2 weeks versus every week? And just have a conversation about it, right? It's not meant to be confrontational. She's already told you that every week is what is ideal based on her test results at this point, so just ask her. So what makes you want to come here? Well, corrective care was a lot of money, and I want to keep going. I don't want to lose my results, but I feel like I have to, save a little bit and maybe not put as much money out. Okay, one of the upsides is at this point, either way, every week or every 2 weeks, you are going to move to the VIP program, and so there will be a significant drop in your fee structures. So sometimes at that point, they'll go, oh, well, so what would it look like? Right? What would it be if it was every week? Because remember, up to this point, they might have been paying $470 a month, right, for a corrective care period. They could have been in an intensive phase, maybe prepaid $1,500, $1,800, $2,000. And so they're thinking, oh man, is this going to be the same? I can't put that much out, but I do want to continue on with the process. So sometimes it's as simple as saying, oh, well, you're probably going to be in the range of, and whatever it is for your practice. So I think in ours, it's every 5 to 7, and rebuilding it's like 180-ish, 189 or something like that. So if she's thinking $470, and then you say, well, it's just 189. Oh, well, I can do that. Okay, well then let's go ahead and I'd anchor the agreement again. Then let's go ahead and we'll do every 5 to 7 days. We'll do that for 21 weeks, and then we'll go ahead. I literally say the exact same thing. So all of the anchoring of the agreement statements, don't bypass that. So don't listen and Chantel says, okay, yeah, I could do that. And you go, okay, great, come on with me, right? Because you didn't anchor that agreement. You tried to anchor before. It got bypassed. There was an objection. We handled it. We're good for every 5 to 7 days. Anchor the agreement. Okay, great. So what we'll do is, so that's a great segue in your mind when you're ready to anchor is, what we'll do is, let's go ahead and, right? Also great for staff members. Somebody's at the front, you're doing a reschedule, and they're humming and hawing about, coming in on Wednesday or the morning. Listen, we've got to keep you on track. Let's go ahead and schedule you in Wednesday morning. Well, I can't do Wednesday morning. Not a problem. Let's go ahead and schedule you Wednesday afternoon. Well, I guess I could do that. Okay, great. So you're going to be here Wednesday at 5 is your normal time. I'll see you then. Right? You're just being assertive and helping people maintain accountability to these agreements that we're making. So the staff and the doctors work very closely together. The staff is responsible for about 80% of accountability, and the doctor is responsible for 20%. And the reverse is the doctor is responsible for 80% of the agreements, and the staff is responsible for about 20% of the agreements. So your staff is your number one. Their number one role is accountability and holding people accountable to the agreements that the doctors make with the patients. And then in reverse, the doctor's job is to make good agreements. So you can see how this all falls apart, right? So now the doctor doesn't make a great agreement with Chantel. She comes up front. maybe we go ahead and we get today's schedule, and then she leaves after a checkup. She's like, you know what, I think I'm just going to do every 2 weeks. And all of a sudden, that agreement that wasn't made is also now put on your team, and they're trying to handle the responsibility. Well, Dr. Derek said that it was going to be, every 5 to 7 days, and you only want, and it just becomes confusing. And what happens with people who aren't clear? They don't buy, right? They don't consume, they don't move forward. So everything's got to be clear. So let's say now in a second example, let's say Chantel didn't get the answer right. So instead of wanting to go 10 to 14, she just didn't get the answer right. So I'll say, so Chantel, you can reply to this with every few weeks or once a month or something like that. So Chantel, how often have I been checking you?
Twice a week.
Okay, and how many times have I never had to correct you?
Never.
Okay, great. So given what I just explained about the rebuilding phase and what's required, what do you think would be the most logical schedule or the most logical frequency for you in this next stage of care?
Like monthly?
So once a month?
Yeah.
Okay. So let me ask you this. I've checked you twice a week, and on the second checkup for the whole 16 weeks, there's never been a visit where within 2 days of your first visit, you didn't need a correction. Is that correct?
Yep.
Okay. And the goal in rebuilding is to keep your body going forward, right? Keep the spine and nervous system getting healthier. Do you think it makes sense to wait 25 to 28 days with the spine subluxated and shifted before I check it again?
I guess not.
Right. And so again, it's got to be based on what the goal is. So if the goal is to continue to move forward, then you've got to set your frequency at least somewhere relatively close to where you're not going to be shifted for long enough that you'll start losing results.
Okay.
So based on that, what do you think the most logical frequency would be in the rebuilding phase?
Weekly.
Yeah, probably about every 5 to 7 days. So now we're at a crossroads. The agreement isn't made yet because she's just come to the conclusion that, begrudgingly, every week is probably what is ideal at this point. Clearly, she does not want to come every week, at least in her mind. So her thought was, okay, great, I'm happy with my results. If I could just do once a month now, this is going to be golden, right? This is where we've got to make a decision together about what the goal is, right? So I would probably say something along the lines of, okay, great, so you would like to come every month. I understand that. And at this point in your care, whatever we decide together, I'm actually okay with. Every month is not going to be ideal for you. You are going to spend 20, 25 days shifted in between checkups. And you will likely either lose some results or at best maintain the level of function that you're at now. So what would you say your goal is? Is it to do as little as possible to not go backwards? Or would it be to change the frequency to try to get more optimal results?
To get more optimal results.
Okay, so based on that, what do you think you'd like to do going forward in terms of the frequency?
Weekly.
Okay, perfect. So let's do that. Let's go ahead and check you every 5 to 7 days. We'll do that for, you were at 52, so we'll do that for 21 weeks. And at the end of that, we'll go ahead and we'll do new tests and we'll make some decisions and based on your tests and your goals at that time. Okay, so then it's just like a flow chart. You're just working through the flow chart. You're managing the objection. You're getting a clear agreement. We're not trying to manipulate. We're not trying to, convince them otherwise. We're simply making them face the facts of reality. If she would have said to me in that example, well, every week, but could I do every 2 weeks? Right? That's usually how that sounds. As can I do every 2 weeks? Absolutely. I don't have any problem with you doing every 2 weeks. All I'll say is that it will be less than optimal, but it's still going to be fantastic. But now understand there's an even bigger gap between your checkups, which means that what you do outside of the practice is even more important. So I'm anchoring that because if we get to the next test results and she wants to say to me, I'm not happy with my results, she's going to remember this conversation, right? I'm not happy with my results. Great, how'd you do with your corrective exercises? D. Right, how'd you do with that eating protein in every meal? D. Why do you think you're not getting the results, right? One, you didn't match the frequency that was going to get you a better result. And two, you didn't do any of the other things that were required for you to get the result. Oh, okay. So you've got to have these conversations in the moment. So then we would agree and say, perfect, so let's do this. I'm going to see you every 10 to 14 days. But what's going to happen is it's going to take twice as long. So in rebuilding, what I do is in rebuilding whatever the schedule was, if it was a 5 to 7 day schedule, and we're switching to a 10 to 14, I'll just double the timeline. right? So just make it simple. Instead of a 4-month program or a 5-month timeline, it just becomes a 10-month timeline. I just say, great, we'll check every 10 to 14 for 21 visits. It'll just take twice as long. You're good with that? Yeah. So as long as you know we're going to get a great result, it's just going to take twice the time, then I'm good with that too.
Okay.
Perfect. So what we're going to do is we're going to check every 10 to 14 days. We're going to do that for 21 visits. At that time, we'll do some new tests and we can make new decisions based on the tests and the goals. If it was, I want to be here every 3 weeks, okay, and I would just go through the same conversation and then we anchor the agreement, okay? Is there any questions about that? It's pretty straightforward in the sense that what I love about it most, there really is, if you're willing to have the honest conversation, there really is no stress involved. The person's already told you they want to move forward. It's simply just a matter of making a decision about frequency and making an agreement that that frequency is going to yield XYZ result. Okay? Any other questions about that? And if not, what I'll do next is I'll talk about what happened at the end of that in the RRB and how that becomes different and how the R12 becomes different. Because there's just very subtle modifications. They're almost like scaled down versions. By the time you get to the R12, it's like, what do you want to do? Right? There's the video. I mean, sometimes it literally sounds like this. Hey, Craig. So you watch the video, right? That made sense. Yeah, spine, nervous system, subluxation, blockage correction. You got to do other stuff. I'll do my job, right? Right. So let's take a look at your test results. Right? I'm like, you should already understand this. I'm going to hit a quick recap. Let's show your test results. Last year were this year is this. What do you want to do? Actually, this is the conversation. When we decide what to do going forward at this phase, I have one decision you need to make. I need you to make the decisions to what kind of person you are. Are you the kind of person that wants to do as little as possible and not go backwards? Or are you the kind of person that wants to do what's necessary to be optimal? It's a very powerful question because people then have to classify themselves, right?
You would have a survey with those 3 questions on it.
So at this point, they would have already filled out the questionnaire that said optimization, maintenance, or reversal.
Yeah.
The goal is still to get them to move. So if somebody circled maintenance, I still want them to choose optimization.
Okay.
Right? So I'm still going to work with them to try and help them see things from a different perspective.
Okay.
So let's talk about the 3 choices conversation. All right, so we've got a new agreement. We're in rebuilding, okay? And we've worked through the rebuilding phase. The curriculum at the table is very similar to phase 1, but there's new things you're introducing people to. You're probably talking more about the lifestyle steps. You're really hammering in, because you're seeing them once a week now, really hammering in the corrective exercises. And what we do in our system is whatever goals we agree to, my staff puts them in their digital file. So in any block up here, I can see what your current goals are. So if we decided that she's going to have protein with every meal, and 3 times a week she's doing her spinal hygiene exercises, every checkup, I can see it right on the screen. So if I don't have something to talk about that day, guess what I'm going to talk about, right? If I also know that her goal was to run a marathon, then I can even tie that stuff back to her goal, which is even more important than the goals we set, right? The goals we set are really just to help her get the goals that she wants. So I have goals in a section on the Atlas system, and that way I can converse about those during her checkups. So we've worked through that phase of care, and now we're at the end. We've gone through the testing, and as you were just alluded to, Greg, in the form, I guess, they fill out, it says, what or how did, do you know what the exact words are?
It says choose from these 3 options.
Okay, so choose from these 3 options. I think it says something about the spine and nervous system. And then it says optimization, and it gives a brief description. Maintenance, brief description. Discontinuation, brief description. This is making people face reality, right? Discontinuation. Discontinue receiving checkups and lose all of your results and eventually go beyond or go backwards. You can do that if you want. That's your choice. But you need to at least face the fact that you do have that choice. And so I know going into the room that they've chosen one of those. The technical coordinator or associate doctor, whoever's doing the examination, they would at the examination portion talk to them about their choice. So Chantal would walk into the room, she'd gather them from the front, she'd bring them in, she would look at the forms to make sure that was filled out, right? People like to not fill that part out. right? They're like, oh, I don't know what that means. So she would go in the room, she'd say, oh, hey, Craig, I just see that we didn't fill out what your goals are in the next phase of your care. So let me go over those with you. And then she would go over and you'd make a choice. If you already made a choice, whatever your choice was, she would acknowledge your choice. Hey, Craig, I see that you chose maintenance for your next phase of care. That's great. Let me just go through the 3 choices to make sure that's what you wanted, right? Discontinuation means that you would discontinue checkups, your spine would return to being subluxated, and the nervous system be compromised, and you'd lose all your results and eventually go backwards. And Craig probably says before she even finished the sentence, oh, I would never do that, that's crazy. And you're like, I know, that's crazy, but I just want to make sure you knew that was a choice. I see you circled maintenance. Maintenance means to do the least amount possible to maintain your result. And then there's optimization. Optimization means to do what's required in order to be at the optimal or to be at your best. Was maintenance what you wanted? People change all the time because people's thought of optimization, maintenance, and discontinuation is clear. The optimization and maintenance component, what they think is every week, every 2 weeks, you know what I mean? They think of it like that. I used to do you want to come every week, do you want to come every 2 weeks? I took that off because I don't care about that. What I care about is what is your goal? Because if your goal is optimization, but you want to come every month, then those 2 goals are not compatible, right? The goal and your desire don't match. So you have to change your desire or the goal. So by asking them what their goal is, we can then customize the frequency around their goal. So most people, as Chantal will acknowledge, if they circled maintenance, when she explains it that way, they will generally say, oh, I meant optimization.
Because it's just a terminology thing sometimes, right? Because people, especially if they've had prior chiropractic care, they think, oh, I definitely want maintenance care.
That's right, yeah. They think they're talking about optimization.
Right.
They think optimization means they go back to coming 3 times a week.
Right.
Right? And they're like, I don't want to come back 3 times a week. And if you're explaining, that's not 3 times a week. It's a schedule that is customized to you based on your test to keep you at your absolute best. And they go, oh, no, that's what I want. Perfect. So that way, when I go into the review, the RRB, or Chantal goes in with her patients, she has a clear idea, right? They want optimization. So to me, optimization is going to fall within probably every 5 to 7 days, 10 to 14. I mean, we all know for most human beings, that's, anything beyond that, for most people's test results, is probably not considered optimization. It would be the equivalent to me of, I work out 4 or 5 days a week, that's optimization. 2, 3 might still fall within an optimization kind of range. You start working out once a week, once every other week, we're not going to call that optimization anymore, right? We're going to call that maintenance at best. And that's fine, it's better than discontinuation, right? And so that's the same type of mindset that you can use when you're thinking of how to explain that or how to have that conversation with people, okay? So now we've had it in the room at the tech. They've come out, they've got their checkup, the doctor's reinforcing, hey, Rachel, great, you had your biostructural re-examination today. I'm really excited to go over those test results. We'll go ahead and see you next week after I get them analyzed. Ashley will schedule a time with you. And so checkup, scheduling, reminder call, there they are back in the room again for their next review. The video goes, the difference at this point is exactly what I said. It's, hey, you've been here for 9 months now, 12 months. You should have a pretty good idea of why you're coming. And if you don't, I'm not sure why the heck you keep showing up. Right? Like we usually joke around, have a really light, authentic conversation in that sense. I show them their test results. But at this point, I mostly just show them their score. Say, look, when you finished your corrective care, you were 62, and now you're 71. You're doing great. We're going in the right direction. I don't even show them their test results all the time anymore. Unless they say to me, well, what does it look like? Or can I see what a 72 looks like? Sure, I've got them in there. But for the most part, I just say, now you're a 72 or 71 or whatever the score was. And I bring up the agreement engine, goes over the grading system, I tell them where they're at, and then I do the 3 choices. So it looks like here you circle optimization. I find people fall into 2 categories. They are either someone who wants to do as little as possible and not go backwards, or they're the kind of person who wants to do what's necessary to go forward. I'm assuming you're the optimization type. Yep, that's what I want. Most of the time, at this point, I would most, 70% of the time, people will still choose to stay at the current schedule they're at, which is generally about every 5 to 7 days. Sometimes this is where they'll say, well, I'd like to see what happens if I go less, because I showed them now the lines. So that's where we're now past those first 2 spots in the agreement engine, and we're at the break-off, and I'll say, so the green line is optimization. It generally falls to about every 5 to 7 days for most adults. The blue line is still optimization. Think of it as like a B track. It's about every 10 to 14 days. And then you start getting into what's the least amount I need to do to not go backwards. And you've got, I don't remember the colors, but yellow line is about 18 to 21 days. And then the black line is about every month. And then the red line is discontinuation. And then I stop talking. Or I'll say, what frequency would you like to pursue to get your goal? And it's just like on the day 2, don't say a word. Because they're doing math again. They're just, they're most of the time they're thinking about whether they could drop down and care. Like, I understand that's the mindset. Like, could I get away with coming less? And a lot of the time they'll just circle back around and say, no, I'm not ready for that yet. Or no, I don't want to do that. Let's just stay on the green line. Perfect. So what we're going to do is we're going to check every 5 to 7 days, and we're going to do that. Now, this is where the timelines might change a bit. So if it's somebody's first schedule from rebuild to an optimization, I'll generally stick with about 6 months. So I'll generally do, every 5 to 7 days for 24 visits. I just find that jumping into annuals at that point for a lot of people, they just went, 4 months, 4 or 5 months, 6 months seems like a natural transition, and then they would have had almost a year or a year and a half under your care. And at that point, then I just set them up in annuals for the most part. If at this point they want to make a drastic change in their frequency, so let's assume at the end of rebuilding they were 5 to 7, and I do the lines, and they go, I'd like to try every, the third line down, 18 to 21 days. Okay, great, let's do that. So there's no pushback. Let's do that. Let's do 18 to 21. Just understand you're going to have a lot more time in between visits and have that conversation about what they need to do when they're not here. What I would do in that case is I would definitely only do 6 months. Sometimes I would only do, 9 visits. 18 days. I would do 6 months. In that case, that would be 9 visits over 6 months. Right? My point is, I wouldn't do really long periods of care when people are dropping down, so it gives me a chance sooner to touch base with them again. Right? So I'll use another example. Let's say you had somebody who was in annuals and they were on actual 12-month programs, and they were somebody who was with you for years and years, and maybe they were 5 to 7, and they've just been doing it, and they said, I'd like to come less for whatever the reasons are. I want to come, every 2 weeks. Great. My next program wouldn't be 12 months. It would be every 2 weeks for 6 months. Why? Because it's their first transition down. I want to have my testing period shortened so we can have a conversation sooner. Right? Because what if that every 2 weeks when their test doesn't look as good to them and they're not happy about it? If I don't schedule time to have a conversation, then we're not going to have an opportunity to change the schedule again, or for them to decide to change the schedule. Does that make sense? Right? So basically, anytime they're reducing their schedule, especially from a frequent schedule, especially if they have a long timeline, I shorten timeline for the next phase, just so you can get your testing in earlier and a new review earlier. Because some of the time at that new review, they'll realize they don't like the result, and they'll change their frequency back. And then I go back to my regular 12-month. If at the end of that 6 months they were happy with the frequency and the test results were adequate, then the next one I would do the 12 months again, but at the 10 to 14. That's kind of their new sweet spot. And that's one of the language pieces I use a lot beyond rebuilding is we need to find your sweet spot, right? People who want to keep decreasing care, what we'll talk about is, great, let's try it. Oh, I want to see what happens if I come every 3 weeks. Let's try it. I want to see what happens when I come once a month. Let's try it. Right? I don't know what's going to happen. I mean, I know what's going to happen, but they don't know I know what's going to happen. So let's test it out. And I'll reinforce that that's one of the best parts about having a testing-based practice. The good news is we're going to find out, right? So as they keep going and dropping down in care, it's a chance for us to see their test results decline and to continue to have these conversations with them about the reality of the results they're getting. And a lot of people will bring their own tests, they'll bring their own frequencies up based on the test results that they're seeing. Okay, so you think about what we've done, we've gone through correct, rebuild, and now we're in optimization, on and on and on and on, rinse and repeat over and over and over and over, constantly anchoring and making new agreements with people. So that, I think, manages a large part of the objections. Is there any other things that come up in that process? Maybe I guess somebody wants to drop out, right? So that would be a situation. So let's address that. If somebody wants to drop out,